I think anyone can benefit from just like a wellness exam because you're not getting assessed of the pelvic floor by your OBGYN.
Yeah.
Now, if anyone before having kids has pelvic floor symptoms like bowel and bladder leakage, then I mean, by all means, those people should definitely be getting some care in preparation of pregnancy.
For sure. Hey everyone, this is Dr. Kanita here on another episode of Araya Holistic Health Podcast. I'm here with a special guest, Dr. Maggie Geis. She is the owner of Gaia's Women's Physical Therapy and Wellness, located in Martinsburg, West Virginia. Her practices focuses on empowering women to return to functional and pain-free movement. So I'm really happy to bring Dr. Maggie here. Thank you so much for coming in today. We actually met through a mutual patient, right? And I think she told me about you and she's like, I want to connect you guys. She's actually really good at connecting people.
Yes.
And I wasn't sure, was it you emailed me or I emailed you first? I forget.
I think I reached out.
Yeah. And I was like, oh yeah, we should meet up. So we ended up meeting up in Frederick for coffee and had a fun conversation because you don't meet many women entrepreneurs doing their own kind of practices. And at the time you were doing 2 locations, right?
Yeah.
One in Frederick and one in Martinsburg. So, and now you're mainly focused in the West Virginia area, correct?
Yes, for all in person. So virtual, I am able to provide services to Maryland as well.
Oh, you are? Okay. Good to know. I didn't know that. Now, during the pandemic, was that kind of, did you just start your practice then? I forget.
Yeah, so I launched my practice in February 2020, but I was still working full-time for a hospital-based system. So I didn't really progress my caseload that year.
I see.
I just stayed where I was. So I didn't really start like really treating on my own until the beginning of 2021.
Wow. Yeah, that was a crazy time for all of us, for sure. I think I closed down for a couple months. So, and we were talking a lot about how we managed that and navigated that aspect.
Yeah, in some ways, I think it was almost easier for newer businesses to get started, and like new but already established businesses, I think, really struggled. And so, I mean, for me, it was, I don't want to say it's like the pandemic didn't happen, but like when I started getting patients and it was just like people were like, oh yeah, you're doing this and this is necessary. And like 2021 didn't really like, I grew exponentially in 2021. But yeah, I think it was just like almost an opportunity for that. And a lot of cash-based pelvic floor physical therapists came about because of the pandemic. A lot of like shutdowns and layoffs and stuff like that. People ended up going out on their own, realizing that it could be different in a different setting.
Yeah. I know a lot of the mindset changes with that. And so how did you get into pelvic floor PT? What's kind of the story behind that?
Yeah. So I always had an interest in it. Like even when I was going through school, we would kind of touch on topics like anatomy and different things. I had one rotation in Hagerstown, Maryland, where the PT did mostly orthopedics, but she kind of dabbled in some like pelvic stuff. I think I saw her use a biofeedback unit once. She did some lymphedema and it was cool. I was interested and it was like the most exposure I had. So it was always just like, yeah, that's cool. But like, I don't know anyone doing it. I don't know anywhere doing it. And it was just kind of like no really true avenue to explore it. So I came out of school. I did mostly outpatient orthopedic stuff for physician-based and hospital-based systems. And then I had my first baby. And then that's when I started learning about diastasis and kind of like exploring my own body and trying to seek services and realizing that like, I don't know, something just wasn't adding up, you know, like as physical therapists and what I was being required to do just seemed like really not the way we were trained to do things. So I was really prepared because I knew I was going to be having another baby and that was my focus. And during my pregnancy, I was that girl that was like doing burpees and all the things and like nothing fazed me. And I remember seeing doming and it was just like, okay, I don't know what that is, but like,
you're like, I don't ignore it. It's fine.
Yeah. Like I wasn't in this realm and I didn't realize that it meant something was wrong. And then, so I did have my second baby, and then I dealt with a whole slew of other problems. So I kind of have both experiences of diastasis, and then also pain and exercise resistance. And so when I was seeking care after my second child, I was still looking for people. I tried a couple different places, and it was just like, something just didn't make sense to me. Like, I mean, I was kind of getting better, but it just seemed like there was something missing.
Yeah.
So I finally found a therapist in Arlington, Virginia. I live in West Virginia, so that's an hour
a trek
away. But it really kind of changed the way that I thought about it. And then at that point, I took my first pelvic course when she was like 7 months old. And so from there, I've been like, I was able to pursue pelvic health in the hospital-based system that I was at. So I had an opportunity where I worked at a great PT place where we had hour treatments. They were all one-on-one. And in that setting, I was able to take the pelvic courses and then actually apply that.
Nice.
With a lot of traditional PT settings, it's hard to do that because there's not one-on-one treatment.
Yeah.
And so I was in a place that I could pursue it, and then it was top of mind because I was dealing with my own issues. So it just kind of, and then I think it was starting to come around in like the PT world and just like media. I think people were starting to talk about postpartum and having babies and bodies changing. And I think the conversations were starting to happen. And so it just kind of like led me into that path.
And around what year? So when did you have your second?
So I had my second in 2018.
2018. Okay. And then that's when you started to have all the issues, you said, and trying to figure out all that yourself too.
Yeah. And then just trying to find care.
Yeah.
Like not even like actually finding care, but like in my area, there was nothing within my immediate area.
So 2018. It feels like it's only 5 years ago. And now it's starting to come up, like all the topics of pelvic floor health.
Yeah.
I think at least for me, and I see, maybe you've seen it too with my practice, they kind of, after a while or after you get pregnant and then you have the baby, they're like, go ahead, go forth. And after you have the baby, it's like, okay, you're on your own in certain aspects. If you have pain, they're like, oh, just wait it out a couple weeks. Yeah. But before we get into that, let's talk about the pelvic floor. Like, I'm sure, some people know about it, but what's kind of like a foundation or a basic understanding of pelvic floor just for people out there that don't understand that so much? Yeah. So I try to explain it to people that the pelvic floor are skeletal muscles, just like anywhere else in your body, your quads, your biceps, your calf muscles, because we can't see them. They become this very like foreign entity that no one knows like where they are or what they're doing. And so first I tell people that is like, they stretch, they contract, they lengthen, they shorten, they can have pain, like all the things, just like any other muscle. I think the other thing is just that there are multiple of them. Like it's not just one down there. I think people think that it's just like this a muscle. Yeah. I guess like the diaphragm is like a big one muscle, right? Yeah. But yeah, so there's multiple muscles that make up kind of that pelvic bowl. The main functions of the pelvic floor are sexual function, sphincter control, core stability, organ support. Yeah, organ support. So pressure management. And so like it is the foundation of us being able to utilize our body efficiently. So if someone has altered breath mechanics, that could potentially alter any other system in the body. And so even patients that come to me with, knee pain or incontinence and knee pain, the relationship there is huge, but like they're not really aware of that. And it can be, if you're not solid and functioning and efficient in your pelvic floor and your core region, which I know can be a hot topic too, like what's the core, but like if we're not if we're not functioning optimally at our center, then like we're more likely to have extremity injuries, shoulder, hip, knee, like whatever. Totally agree with that. It's like in the same. So for us too. Yeah, it's just a group of muscles. Now, I think because like you said, like people don't know it exists. They're like, oh, I know I go to the bathroom and do all these things, but it's like a taboo thing. Like no one wants to talk about how they poop or pee. Right. Yeah. It's kind of embarrassing. So that's why I think it's hard to talk about the pelvic floor. People are not aware of it so much.
Yeah.
So from my understanding, there you have the core. It's like from my understanding of my background, and you can totally correct me too. I tell my patients this core is not just like the 6-pack abs, because that's what people think, like, oh, it's this area. Yeah. It's actually like a canister to me, with the whole including the diaphragm. Like you have the top, right, that you think the diaphragm part, but then the bottom of the canister is the pelvic floor. Yeah. So you need those to kind of expand and contract in all directions.
Yeah. And sometimes I even explain that the top of the canister is actually the glottis.
Oh, I think you did write that. I was like, oh, that's interesting.
But it can kind of be like a canister within a canister. Like, you know, the diaphragm is important and certainly sits in the middle, but really like, if you look at a picture of the vocal cords, it looks very similar to the pelvic floor. Yeah. And so we technically have 3 diaphragms: our vocal cords, or like esophageal area, the diaphragm, and then the pelvic floor. They all kind of operate as diaphragms. That's so cool.
Yeah, I didn't think of it.
And they manage pressure. And yeah, and I think the breath and how it moves, like not just the diaphragm, like in the upper quarter, is super important too.
Well, that's cool. I learn something every day. Like that part I didn't think about so much, but now you're saying that it looks similar to the pelvic floor. Now I want to go look that up.
Yeah, no, you really should. And then, I mean, I think a place where that comes in a lot is with birth and labor. So like when I talk to people about that and using the sounds of their breath or the sound of their voice can alter what happens. So if someone is like a sharp, shrieking sound, like a higher pitch sound, is going to cause more of a contraction, whereas a low tone is going to cause more of an opening. So if you are having a baby, we practice like, what are the low tone sounds? Like, what does it sound like if air comes out through a narrow opening versus a wide opening? And so that's why you're going to hear people in the birth world are going to say moan, groan, lower, lower, because they want that sound to be like so low and opening versus like
high, because it causes like too much tension. Yeah. That's so crazy. I love that. So there's a little bit of a tangent, but that goes into at least a Qigong exercise, which I can show you. So there's actually the sound, the organ sounds. So you have the lung, liver, spleen, heart, and kidney. So changing the and they use more of the Chinese, but when you do a specific mouth and you do that tone, you actually vibrate that organ. I didn't believe it, and then when you do it, you're like, oh my god, it is.
You can feel it.
Yeah. So like when I do the specific sound for that organ, you feel the vibrations. Yeah. And so that totally makes sense that the different tones will affect birthing. So that's kind of crazy. Yeah. So we talked a little bit about the pelvic floor, which is awesome. And for people wanting to get pregnant, in terms of pelvic floor therapy, to me, is this something that could benefit them, even if they don't have an issue?
Yeah. So, and I think there's 2 components. Yeah. So when it comes to like someone who is maybe on a fertility journey or, thinking about getting pregnant, but not, so there's 2 ways to think about it. So there are a lot of practitioners that are in the fertility realm, and there are fascial techniques and organ support things that we can do to facilitate fertility. And that is not something that I'm well trained in, but it's definitely on my radar. But there are therapists that do that, and there's really good support in finding that help, like through fertility stuff. On the other side of that, if they're not struggling with fertility, they're just like, what the heck is like going on in my body? Like all these people are starting to talk pelvic floor. Like what if there's something wrong with mine or something?
And they're just like, how do I know?
Yeah. So I think anyone can benefit from just like a wellness exam, because you're not getting assessed of the pelvic floor by your OBGYN or GYN. So like just having that assessment of like, okay, like this is what I'm finding and can you use it? Now, if anyone before having kids has pelvic floor symptoms like bowel and bladder leakage, pain, then I mean, by all means, those people should definitely be getting some care in preparation of pregnancy, just mechanically, like the things that are changing. But I think just for their own education, I mean, the connection that you can get after learning about something that you don't even realize exists, like really starts connecting you to your body. And I think it's important that we learn and know what our bodies are doing and what its function is. And I think that's part of why like labor and birth and pelvis stuff is like stressful and frustrating, and it seems like no one really knows what's going on because there's just like a true lack of connection there. So yeah, I think just investigating like what does your pelvic floor do, even if there's nothing wrong with it. But then if there's any dysfunction already existing, then they should certainly be getting assessed because things can be fixed like quickly with pelvic PT. And you could go into a pregnancy not having any problems. You could also start PT during a pregnancy and resolve issues before you even have the baby, which this is the other side of things. But like, you know, providers are saying like, oh, just either they say, why are you getting pelvic floor PT? It's a waste of time. Or they're saying, oh, just wait till after your pregnancy. And it's like, why? Like we can literally fix that stuff now.
Preventative. Yeah. That's the hard part that people like. They're more, you know, now it's more reactive medicine versus like, let's actually prevent it and not have all these issues beforehand. So that's a great point that you're making there too.
But yes, the answer to your question is, I think it could be valuable, whether or not someone is currently having dysfunction or not, if they're preparing for pregnancy.
That answers my question. Because I know I reached out to Dr. Maggie, you know, preparing for a family. And this is the planner in me is like, what are all the things I need to do? And I'm trying to slowly build my team for this as well. So, no, this is great. Like, I'm learning so much from this. So I'm so happy that you're here talking about it. And of course, I think you mentioned that men can get it too, right? Yeah.
So pelvic. So I specialize in prenatal and postpartum. That's the majority of my practice. But yes, like men have pelvic floors, children have
we don't
pelvic
think
floors.
about that. Like, oh yeah, men have pelvic floors.
Yeah, we think of like pelvic floor as a niche within, you know, PT or orthopedics, but really even within pelvic floor, there can be providers that, I mean, treat further along than I do, or that they actually like have even more specialty in pediatric pelvic floor, oncological pelvic floor, men, neurological disorders, so strokes, TBIs, that kind of thing. Those are the ones standing out to me. But there are like sub niches within pelvic floor, like the whole umbrella.
That's really cool.
But my specialty is mostly, but I also see into the menopause, and I've also seen as young as I think 14 or 16.
Oh wow, okay.
For endo, pelvic pain, those kinds of things.
Endometriosis is a big one too. Also really treatable with Chinese medicine.
Yes.
So the combination would be awesome. So some fun questions for you. So actually, I'll do this one because it's kind of interesting. Is it true that when you get cramps in the groin area, so this is, I'm assuming this person would be pregnant, does that mean that the baby is scooching towards the groin? What are your thoughts on that, Dr. Maggie?
I mean, there could be a lot going on. There's a lot happening in a very small area. But yeah, I mean, I think as a pregnancy progresses, if baby's starting to like get into the pelvis a little bit more and sit a little lower, for sure, there can be some pressure and some groin pain. I think round ligament pain, though, would be another like differential that I would be considering. The round ligaments are on both sides, and they can be painful when they're getting stretched. It can be one, it can be both. And again, so if you're coming through like a growth spurt in a section of pregnancy, or if you've done an activity that maybe like kind of stressed that area, the round ligaments can be sore. I always tell people, I remember from my first pregnancy, I couldn't walk. I told you I was like doing burpees and all the crazy stuff, but I could not walk in a straight line because my round ligament pain was so significant. And I think it was just the way I walked and, you know, created stress or tension on those ligaments. But I think, you know, what else? I mean, there's like neurovascular structures, there's nerves that could potentially be going on.
So a variety of things could be. Just go see someone to see what's going on down there.
Totally treatable. I think it would you would need someone that would investigate like where it's coming from.
Makes sense.
Then kind of correct that, whether it's like manual therapy or posture or something like that.
So you talked about a little bit of the round ligament pain, and I think someone asked about what is symphysis pubis dysfunction or pelvic girdle pain.
Okay. So pelvic girdle pain is just like pain in the pelvis. That can be front to back. It can be the whole way around because it's a ring. Many times SI joint pain or dysfunction, sacrum pain, even low back pain can kind of fit into that a little bit. But really it's kind of that belt of like the widest part. And it's just a very collective term of like pain in your pelvis that goes around. I would say pubic symphysis pain is a kind of pelvic girdle pain. Okay. So pubic symphysis dysfunction is that lightning crotch that people feel. Ooh. It's very central. It can be tender right in the front of the pelvis. It can be very painful and very irritating. It can be challenging to treat depending on like the severity of it. But it's also like very mechanical. So for me, like I'm just trying to figure out where the muscle imbalance is. Okay. I'd say most people think that pubic symphysis pain is because the baby's going into the pelvis and the pubic symphysis is coming apart. And that's not typically the cause. Okay. It's actually an asymmetry. Okay. So typically there's like tension or weakness or some sort of like lumbopelvic rotation. And so it creates more of a shearing force, whether it's like side to side or up and down or oblique or something. That's more of what causes the pain. So people are saying they have pain when they try to get out of the bed, when they go up and down steps, when they stand on one leg to put pants on. So asymmetrical activities are very painful because it pulls them into that shearing force. So the goal is to find where the asymmetry is coming from. And try to correct
that. Yeah. That makes sense.
And it can be very different. Like it's not a particular direction for every single person. Like it's very just independent on their body, how many pregnancies they've had, old past injuries, all that kind of stuff.
Did you ever have someone maybe adjust that area? Would that be a possible treatment option?
For sure. Yeah. So, and I think as far as like, body balancing and like body symmetry, skeletal symmetry. Yeah. So those are definitely people that I tend to share with chiropractors. Yeah. But I do think, so like adjusting the like musculoskeletal system is helpful, but then typically they also need you need to know what the asymmetry is so that you can then give them like a corrective exercise typically.
Or at go least back into that dysfunction. Yeah,
because they tend to because pregnancy, we are just getting by. Like, our body is like making compensations, right? For sure. And so I just feel like people fall back into those compensations without like a strategy to correct that asymmetry. But yeah, totally. I mean, adjustment totally helps because the lumbar spine and the SI joints and the sacrum and all that is affecting pubic symphysis. It's a ring. So if one part of the ring is tilted, the opposite part of the ring is affected. Yeah.
No, that's great that you said that, because I think a lot of people forget, like, when you get adjusted, but if you still have that same, like, musculoskeletal dysfunction, or you're still walking the funny way, you need some corrective exercises so that you're changing. I talked to about my patients about this too, like the resetting their neurological part as well. The same thing when I treat someone too, they're still going to go back doing the same things,
Well, right. And that's where I think, and this is mostly how I market to chiropractors specifically, is like, if someone's not holding their adjustment, or they don't start holding their adjustment, we have to like dig deeper. We have to like find where the dysfunction is for the reason why, because if they've had that motor pattern for 2 decades, like, it can, like, they're not holding it. If they're not responding super well as you would expect, like, there might be something underlying. And that's where like the internal exam can tell me, oh, well, this right side is tight and this left side is, I don't know, fine or weaker or whatever. And so we can release the one side and the chiropractor can do the adjustment. And then I can provide some of the like internal treatment and corrective exercise that is showing up like mechanically.
Yeah, I feel like I have so much asymmetry because I play tennis.
Oh, yeah.
When they treat me, they're like, I can tell you play tennis. I'm like, oh, man.
Start playing with the other hand.
I know. They actually said that I should start playing. I was like, man, it's so hard. It was really funny. No, that's great. I think that's a thing that people forget, that it's not just about, getting a quick fix, but you have to find the deeper root of the issue, the neurological dysfunction that might be going on. So great. That's awesome. I think you talked a little bit about this, about the signs. What are the signs of tension in the pelvic floor, like bowel or urinary incontinence? constipation, hemorrhoids, fissures, and for some people, painful periods, so the endometriosis, right? Also, we have painful intercourse, chronic pelvic pain, overactive bladder. So all these are signs of tension in the pelvic floor. So going to see a pelvic floor therapist is really important. Another thing, I know we talked a little bit beforehand about this and on the pronunciation, is the diastasis recti.
Yeah.
So what is that exactly? I know for people it's becoming more of a term they're getting familiar with and getting treatment for, but what's kind of the diagnosis for that? What's going on and what can we do to help with that?
Yeah. So during a pregnancy, diastasis is something that naturally occurs so that we can support a full-grown fetus. So what happens is the tissue, what we call the linea alba, it's tendinous tissue. It's, if you look at a diagram of anatomy, it's white, and it just stretches so that like we can grow, so that our abdominal wall can expand. So it's normal and present in nearly 90 to 100% of full-term pregnancies. And it's part of something that our body does so that we can carry. So it is not a dysfunction. It's not abnormal. It's not a pathology. Like, it is normal and should probably actually be happening so that like our body can adequately like carry and support a full-term fetus. So postpartum, what happens, that's when most people are worried about it. I think the terminology has gotten really misleading. Because really it's a stretching and thinning. It's like, think about like a piece of cloth that has been kind of like pulled apart, where some of the fibers are together, but instead of it being a really woven cloth, you can kind of maybe start to see through it a little bit, or it becomes sheer. And that's more of what happens. It's not a tear. It's not a gap. It's not a hole. It's not a hernia. It's just like a thinning of that material. And so then the baby's delivered. And then that tissue, doesn't just go back, just like the rest of our bodies, you know. So I think over time, what happens is there becomes concern of like, what's a diastasis and what's not. And truly, diastasis should not be diagnosed before 12 weeks postpartum, because in that acute tissue healing time, the tissue, your collagen, like things are starting to go back, and someone who has a gap or a diastasis at 4 weeks postpartum, like that's pretty normal. And that's like, it's still healing. Like there's no sense to even really provide intervention really that early. Like, I mean, we can teach someone how to more adequately use their abs. Like we can facilitate better mechanics, right? But like, we can't say to someone at 4 weeks postpartum, like, oh, you have a diastasis. Like, we've got to work on this. This is a problem, right? Because at 12 weeks, they could have, with no intervention, they could have absolutely no signs of anything. And then there's lots of debate on like the measurements and things, but the width is what gets a lot of media attention and social media and things like that. And people are like sticking their fingers in and seeing how many finger widths can fit in between their muscle.
That would freak me out. I don't think I would do that.
But really, so the width is important and gives us information, but really the other thing that isn't well talked about is the depth. And the depth is important because, again, if we're looking at like how tightly woven is that collagen and that linea alba, the tension is giving me more information than the gap. Because someone can have a wide gap, but firm tension. That's a sign that the linea alba is transferring force, that we've got control of the abdominal wall, that there's strength there. Whereas someone who maybe that material after 12 weeks or so is super squishy and I can push into it. I don't feel a lot of tension, but maybe it's super narrow, right? Maybe it's only one centimeter wide. Well, that person technically is still having trouble. That would technically be a diastasis based on tension, not diameter or not distance. And it's a diastasis because a diastasis is the inability for the linea alba to generate force across it. So both of these people, someone who has wide but good tension and someone who's narrow but poor tension, both of them could benefit from abdominal coordination training, basically. So what I look for is how does the whole abdominal wall function together? So that's a little bit about like how I approach it.
Yeah, I'm gonna like process all that because I think you're right. It's been misleading because we think there's something wrong.
Yeah.
But now it is, at least 12 weeks postpartum is completely normal to kind of have that unless, you know, we start to have issues after that and it's not healing as well.
Yeah.
Let's see. I actually was thinking about this one because males could have this as well. And I do see it on some of my male patients who when they get up, you do see the bulging. And actually, you're making me think I should move around and palpate around there.
Yeah. So, okay. So with men, so the foundation of it is there's poor pressure management too. So like if someone is showing a lot of that like doming or coning through midline, it's a sign that they are, I mean, not usually using their abdominals efficiently, but they're not managing the pressure. So the pressure is protruding through midline, which for a man can lead to hernias, umbilical hernias, inguinal hernias. If the pressure is really forceful, then we could have like herniated discs, right? We can have hiatal hernias.
Yeah, because the pressure is not being managed. Yeah, that makes sense.
So for women, so we've got pressure through our midline, so it can come through midline and look like, you know, someone could have an umbilical hernia, or it just looks like that balloon's blowing up. But also the other struggle for women is that our pelvic floor is then not in an optimal state because we just had a baby. So like the men are less vulnerable in their pelvic floor. They don't typically have, you know, they could, hemorrhoids, right? Would be another pressure management problem. But for women, that's where like pressure management can lead to prolapse and incontinence and a lot of things. So at the heart of diastasis, it's a coordination issue, maybe a strength deficit, but it's also just a pressure management problem.
Oh. That's a good way to think about it. Actually, that makes a lot of sense.
Yeah, like the pressure has to go somewhere.
Yeah, so it's going to find a way, find the weakness, essentially, like the gap. So that makes total sense to me. I know he has actually a lot of low back pain, so I was like, that makes sense. He needs to
learn how to use his transverse abdominis.
Because there's like layers, right? There's layers of the core other than the T. I remember. I was actually trying to remember the name of that too earlier. That's what it was. Yeah, the TA. Just being able to transfer all the like the tension across like doing the different sports too. And he plays a lot of softball. So
so a lot of like rotation.
Yeah. You're helping me with this, baby.
We might need to find him.
Yes.
A pelvic PT.
I'm like, you need a pelvic PT.
Yeah.
So we addressed a lot of the diastasis recti. So I think this is really great. I think people think it's a really bad thing. I need to fix this right away postpartum, but not necessarily. So,
well, and like I said, I mean, I don't want to like, it's worth intervention.
Yes.
It's just like, I think what's happening, what I'm seeing more often in my practice is that like women are terrified they have it. And then they're going to providers that aren't super well versed in its assessment and they're scaring them more. And so then they're coming into my office and they're like, oh my gosh, like I haven't moved in 6 weeks because I'm so worried about this gap. And so I think it just needs to be like, it's not that we can't start intervention at 4 weeks postpartum. Like we totally can. I see women as early as 2 weeks postpartum if they're in a place to be able to see me. But I think what it comes down to is like making sure that we're not restricting movement and that they're getting proper education. And it's not something to like not pick up your baby over or
you still need to
like move functionally. You know, there are ways that we can optimize it and intervene early, but it's people are being scared to death by it and then not moving, like literally like terrified.
That's also not good.
Right. Yeah. Like terrified of doing exercise or picking up their babies or their older children or like moving forwards in their like movement. And they're just stuck and not doing anything. And that's like a bigger problem.
Yeah. Yeah. So it's the other end now. It was like people who don't have any idea of it and then people who are really scared to do anything or like exercise at all. Actually, I had a thought just now too. Have you heard of that? The company Girls Gone Strong.
Yes.
Yeah.
Good program.
Okay, good.
Yes.
Because I do that. I was like double checking. This is good.
Yeah, no, they have a really good panel of people that like collaborate on that.
Yeah.
And yeah, no, that's a very like,
yeah, I actually been doing a program just to get myself ready in general, like my body. So it was interesting because my best friend actually did one of the workouts with me, and she's like, "Oh my God, you're doing a lot of." I was like, "Yeah, because we're preparing," and she is too. So I was like, "This is good for you. You should try to do this program."
Yeah.
No, that's really good to know, because I think transitioning to when I eventually, hopefully, do get pregnant, I want to keep moving.
Yeah.
And do that because, I go crazy when I don't get to exercise for a while. So this is great information about that. Another fun question. I never seen this. Should people use a postpartum belt? I never actually seen what that looks like. I have seen some people wear during pregnancy though, like some support too. Would you find that like reasonable to do if they're having some maybe discomfort or...
So during pregnancy, I think, there's various things on the market that can be helpful.
Yeah.
I think for people who feel like they're, if they're having the waddle or they feel a lot of front pressure or heaviness or like low back pain, I think a support can be okay. I tend to recommend the Upsy from Belly Bandit.
Okay.
It's super comfy. I think it does like a little bit of like compression, but also a little bit of a lift. So it can feel really good. Pregnancy belts are not super functional as far as changing position though, because of where they sit and where the tummy is.
Okay.
Like it's for someone who does a lot of transitions, like a PT, for example, if they're like squatting and then sitting and then standing, they don't like fold well, they don't bend well. So they're better used like if someone's starting to have some pressure or pelvic girdle pain, but they want to keep walking, then that would be because we don't want them to stop walking. So then use this support so that they can continue. As far as postpartum, I don't think people need it. The people that I think I recommend it to are people who are showing signs of like significant abdominal weakness or a lack of coordination or just like core control during their pregnancy or multiple pregnancies. And maybe they have a tendency to show signs of like being more stretchy in general, like more flexible people, hypermobile people. Those people might feel really like vulnerable in their tummy area after the baby comes out. And then that, the skin, the tissue, the abdominal muscles are just kind of like really disconnected because of either intense prolonged stretch or repetitive intense prolonged stretch. So I only recommend it to people that like already are dealing with a significant diastasis, maybe from a prior pregnancy, or that they postpartum, they just feel like, it's hard for them to like get out of a chair. Like some compression there can be helpful.
Yeah, that makes sense.
But I don't think it's necessary for like every postpartum person. I don't think needs it.
Do you see this for some people that have cesarean as well? Do they need any other support, or is that... I actually had a question about like some of the C-section scarring and your therapies with that as well.
Yeah. So sometimes, so just because the abdominal muscles are impacted a little bit more, the compression belts can be more supportive to C-section moms. Personally, what happened for me is they don't hit you in a very optimal location because your incision is at the bottom of your torso, and a lot of the wraps also are there. So there's Belly Bandit is a great resource. There's a couple other ones out there that have some good products. But yes, compression can be helpful in like transitions and pain management. For me, when I was pregnant, I feel like I didn't have as good of resources, but they weren't super comfortable on me. So I think that might depend on the person. If the compression feels good, or if the compression like just does not, if it makes them feel worse.
Yes, for the C-section, with the scarring, I guess, how do you assess that, or what do you see in terms of dysfunction with C-section scarring, or what are some resources people can get to help with maybe the numbness or the tingling? I actually do a lot of like the acupuncture around the scar, and that's been really helpful for them. Yeah. For some of the patients I've had come to me after a C-section.
Yeah. So, you can start like tissue work and desensitization. Away from the scar. like as soon as you want to. Directly at the scar, we don't typically like work at the scar until at least that 6 weeks, and there's
6
like
weeks,
good closure.
Yeah.
But there's been plenty of people that I've worked above and below.
Oh, okay. Really cool.
In the meantime, like if people aren't all the way healed, or if it's just too sensitive at the incision, then going above and below can still be helpful. So for me, I make sure that I look at both like superficial and deep adhesions. So I'm looking for like, does the skin move? But then also like pushing into that tissue and like seeing if the other layers of tissue are also moving. So, I mean, I see, pain in the C-section scar, abdominal wall pain, but also some of the adhesions can also go onto the bladder, to other muscles of the abdominal wall. It can lead to pelvic floor tension. I think for a lot of different reasons, like maybe scar, but also I think just the way you carry yourself postpartum. There can be like an emotional contribution from like what someone dealt with to get to a C-section or afterwards. And that shows up in our pelvis pretty heavily. So yeah, I think I look at like superficial and deep and then see what's tolerable, but then consider the fact that like there can be some internal restrictions as well. Bladder.
Yeah.
Specifically.
The bladder.
It sits right under.
Right on top. Yeah. I've seen some interesting where like the scars are like maybe this big, but then on some women they're like huge. I'm like, what are the doctors doing? They're just cutting. And
the small ones on the surface, but then if you really feel like out, it's much bigger inside sometimes.
So you're saying even with the small scars, it's much bigger underneath?
Sometimes. Like if someone is having a hard time and like, you look at the scar and it's like, oh, it looks fine. But then you really like start to feel the deeper tissues. You can find adhesions that are much deeper. Another thing I've had someone respond to is just ovulation pain. Oh, okay. So I've had someone respond really well to C-section mobility work to ovulation pain.
Oh, really interesting. Yeah. All that's connected, right? The tissue and the fascial connections with that. I know, one of my teachers that I do a lot of like the Tui Na, so it's like Chinese medical massage, but some of it's very gentle. We actually do have like a bladder manipulation.
Oh, yeah.
It's really interesting. We did work with someone that had some... but this was a while ago, like when she had her baby, but she still had some issues with her bladder then. So it's like all this maneuverability with the legs. It was a little tricky for a small doc like me to do it. But yeah, that's pretty cool that you can kind of go in there and help with the bladder as well. Yeah. Oh, we just wait for There's a lot going on today. Another question that I have is, there's a lot, is the postpartum 6 weeks an accurate timeline for people to get back into exercise? Is there a lot of like science to this or like what is the 6 weeks timeline for people in general? Yeah.
So, I mean, I think it's maybe a little bit made up, but maybe
it could be. People are like, nah, 6 weeks.
Maybe a little bit like tissue healing time, 6
I think
weeks.
The tissue healing would make sense.
Yeah. I mean, it is like the average that we say, for most like, post-surgical, waiting for the C-section scar to heal within 6 weeks. So like most acute healing, like tissue approximation type stuff is happened by 6 weeks. So whether you had perineal tearing or intravaginal tears or just kind of like the scraping or abrasion of the vaginal walls as baby came out, so the assumption is that at 6 weeks, the like acute healing is finished, is over, is good. I think what's misleading is that that's like the beginning of the second phase of healing, So I think the way I explain it to my patients is a yellow light versus a red light, green light. So what people are hearing now is okay, red light 0 to 6 weeks, like basically all you're supposed to do is maybe walk, right? And then at 6 weeks you get your clearance, but there's no direction. So people are running at 6 weeks, but not 5 weeks, right?
Weightlifting or doing
and they're jumping back into things that like they just want to get done. They want to get back to. And so I explain it. It's actually really a yellow light, like, and that yellow light can start as early as 2 weeks or days postpartum, honestly. I mean, it depends on your headspace and
how your body's feeling.
Yeah, like how your body's feeling, you know, where you birth sometimes, like the stress, when you go home, if you had your baby at home, like what's the environment around that. So, but like breath work and connection can start days. To the first week postpartum. Now, if that's something that works for you, then you can then like progress through by 6 weeks. If you're like connected and moving and walking and like you've made that like breath connection, then like you might be appropriate to start going to that next phase. But really that starts when you start with connection. So if you had a traumatic delivery with a lot of injury and at 6 weeks you're like, maybe you're still bleeding. Maybe you still have sutures intact. Like maybe you're like in no way, shape or form even thinking about movement. And that doesn't start for you until 4 months. At 4 months, you start with breath work and connection. And then we're going to progress you through. And I mean, a progression from like connection all the way to like impact running HIIT style can take as little as 12 weeks and it can take longer than that depending on like someone's prior movement, someone's symptoms. But the way I typically talk people through it is initially it's connection and breath work. And then you move into purposeful movement, say, you know, bridges, clams, wall push-ups, like things where you're like purposely moving your body. You're not just going for a walk. And then moving into body weight strengthening, loaded strengthening. And then considering. So you need to be pain-free, leak-free,
leak-free,
functional.
Leak-free is a good one.
Weighted, you know, squats and lunges, single leg, double leg, before you're heading out to go for a jog or go do a higher intensity workout.
I was going to ask, do your activities before, like, even before you get pregnant, kind of influence like the postpartum part as well, and like if you kind of address certain things during the pregnancy? I always think about that because I'm like, well, I has like one of my friends and she was like a triathlete, like marathon runner, all this stuff, and she's a chiropractor as well, so she bounced back pretty fast with her pregnancy, like postpartum. But I think because she did, like you said, the breath work, connection, and like slowly increasing load, like she wasn't going to run marathons right away. Yeah. So it can, but I wouldn't necessarily like bank on that. As someone who is an avid exerciser, has been an athlete, so it can facilitate, like if you stay connected to your body during your pregnancy, then you're more likely able to connect easier postpartum. But again, you can be an athlete and have, you know, extensive injury or unexpected things, mental health situations, that like it doesn't come back just because, you know, you ate well and you exercise. So it can be very individualized. But I do think that people who are more used to moving their bodies and have better body awareness and more connection, they are better able to connect postpartum. And then I think they might, if they're not foreign to movement, then they can move through that like functional movement scale. And know kind of like, oh, not quite yet. Or like,
well, and they might like move through it a little bit quicker. But also like, I mean, pregnancy in and of itself, you're not making a ton of gains, right? Like, I mean, so your job during pregnancy is to like do cardiovascular and weightlifting so that you're taking care of yourself and to stay connected, but you're like maintaining. Yeah, you're not trying to. Right. And then postpartum, I mean, we're promoting deconditioning, right? Like your job is to rest, like make sure that your body is recuperating from, you know, the full event. And you go back into your, you know, whatever it's 6 weeks or 12 weeks or a year postpartum, whatever you do get back, you are in a relatively deconditioned state. So I think even if you're an avid exerciser, like people think that they're their old athlete, and they're like, oh, I don't have to do that stuff. I can skip to doing, walking lunges, oh, I can just go do a 3-mile run. Like, it'll be okay. But there is a level of deconditioning that's just like not the same.
You have to keep keeping that in mind as well when you're doing all those the postpartum stuff. No, it's a good thing. It's a good lesson for me as well, or just people who are really into at being an avid exerciser. I love tennis.
And that was me. Yeah. Right. And it was very frustrating. Again, part of my whole story was because I did all those things and I didn't run through my second pregnancy, but I did run through my first. And it did not work out for me like that postpartum. I mean, like it was probably, I tried to get back to working out, but dealt with a lot of back pain and a lot of just secondary issues. I probably didn't consistently tolerate working out between 1 and 2 years postpartum. So it was, and I was that person. Like, I'm a PT, like I'm very body aware. I moved my body. I was intentional. But it didn't work out for me, even though I did all those things and, played high school sports and was that person too.
Yeah. So everyone's a little different. I think the main thing too is to not, I don't think women do this too much, is like comparing ourselves to others, because everybody's going to be different. Yeah. So we can't just be like, oh, why can't I get back to this like my friend, or all this stuff. Yeah.
Well, and so there's someone named Brianna Battles, and she has, some pretty cool content out, and her main thing is talking about the athlete brain. So we have like this new version of ourselves, with a baby, with a different body maybe, but our brain is still like our old athlete brain. And that can be very challenging to navigate, thinking that you should be able to do a certain weight or a certain distance, and then maybe not being able to, and just not being able to function at the capacity in your that you did in your old athlete self compared to your post-baby athlete self. And she has some good content.
Too. Okay. I'll have to take a look at that too. Because the main thing is that the control of like, you're so used to being able to control like your movement, your body for so long, but then after the baby will do whatever it wants to you in a way. Workouts
can look very different for a while. In intensity, frequency, duration, where you get it done, right? They can look very different. I think that's really difficult for some people.
Yeah. But it's a good point to make about like we are in a postpartum deconditioned state, to keep that in mind, to be kind to ourselves and not push ourselves so much. Yeah. So we talked about the postpartum 6 weeks. And we talked about the C-sections as well, because I had questions about that. Do you have any general, or maybe this is dependent on the person, any ways to help reduce postpartum back pain and that people may have, like remedies, exercise, or it's a lot of answers to my people asking me, like, what can I do for this? Is like, it totally depends.
Well, yeah. So, I think the majority of back pain that I see postpartum is postural. Okay. So, like, as moms, we're feeding our babies, whether you're breastfeeding or bottle feeding or pumping or whatever, we're I call it C-shaped, right? Yeah. Like, we're like bending forwards all the time. We're carrying baby, we're supporting head, we're hunched. If you're side lying, you're still kind of in the same position. If you're like washing dishes, right? We're just very in a flexed posture. And so what I just try to get people out of that as much as possible. So sometimes I give moms tummy time and tell them to do tummy time with their baby so that they're laying on their belly in some extension. That. Cat-cow is great. Any kind of like spinal opening is great. So, mobility can be like the biggest factor with postpartum back pain. And it's like same with the old guy who sat at his desk for 40 years, right? Like him and postpartum have like the same back pain. So, really it comes from like a lack of movement in the other planes. So extension and rotation. And it doesn't mean you have to go to a yoga class, although that could be great. But it just means, having like a couple movements that are out of your ordinary posture. Yeah,
I like her. So it's funny because just today my friend messaged me. She just had her baby a couple weeks ago, I think. And she's like, I went to the chiropractor. I'm so lopsided. I was like, yeah, you are, because you're home. She's like, yeah, the breastfeeding and the holding and her back's all kind of messed up. And that totally makes sense with with what she's doing. I lost my train of thought too. What I was going to ask. Trying to think. No, that's good to know though about like you don't have to go to any exercise class. It's just like do the opposite movement for a while. Yeah. Oh, this is what I had a question about. Do you have any optimal ways for people to kind of hold their babies so they're not just like maybe like switching sides or all that? Do you have any tips for that for moms, new moms?
Switching sides is good. Good. So it keeps you out of that, just perpetual positional issues. So early on, it can be challenging because, again, you've got, the bobblehead. But so the two postures that you see, so with a newborn, you'll see hips in front of mid back. So they'll like push their hips forwards and then kind of lean back. Right. Okay. So they'll be kind of in extension, but it's fake extension. Yeah. And that's like a whole thing. So they're not really in extension. Yeah. But so it cranks on their back. So that also contributes to back pain, even though they're not necessarily flexed. But so the biggest thing you can do in that situation, particularly like early on, is either baby wear. Hold them like in the center of you where you can support head, but then back up your hips so that your hips are underneath your trunk. So you're aligned versus one part of your body being in front.
Yeah, because some people like hold on the hip, right?
Well, yeah. So then that's the other. So like with an older child, we'll tend to like sit them on our hip and kick out. So again, transferring sides can be super helpful just so that you're like posture for me is that there's not a single bad posture. It's that if you lose the ability to get into the next posture is the problem. I like that. So like if you're always kicking out your right hip, you might have pain eventually somewhere. I mean, it might be right hip, but it might be left back, right? Like, but it's from the perpetual, like repeated
chronic repetitive stress, essentially.
So if you switch sides, you're more likely to reduce that. But then also you can hold a baby on your hip and not kick your hip out. Yeah. So you have to use more core strength. But if you I say like typewriter your hips. So if you bring your hips underneath of you, again, like don't have them off to the side, just bring them underneath of you. Then you're more likely to just remain more have more symmetry and like less opportunity for pain to creep in. They have some great little things out nowadays. It's like you belt something to you and it's like this little pillow. Oh, okay. I don't know the name of it, but it's for like older babies and toddlers, and they kind of just sit on it. They sit on it. You can keep your arm around them, but they have like a little platform.
Yeah, so you're not like kicking out your hip. You don't have to kick out. Very cool.
And baby wearing can be really helpful to help just stay in a better posture so that you're not, kicking out to the side or the front.
Punching over all the time. And I think my teacher told me too, when you like don't pick up your child and like this hunch, like if they're a little older, right, and you're trying to pick up your child, like he said, you could squat down and have them kind of hold and then like use your legs. So you're not like stoop down and twist, this is the worst
like
part.
1,800 times a day.
Yeah. Herniate your disc that way too. Because some people will do that when they're like, pick up my child. I'm like, no, actually if you like squat down, have them hold you and then you can lift up.
Yeah. And I think, like moms aren't necessarily going to remember to do that or need to do that every single time. Yeah. But again, I think it comes into like, how much is the load and how repeated are we doing it? And then finding something like an alternative strategy that, if it is a disc herniation, then like, how can we limit spinal flexion here? What can we do? Yeah. I think there's ways around it without like intimidating moms being like, I can't pick my baby up like that at, 2:00 in the morning out of the crib, so yeah.
Just don't do it a bazillion times. It's like once in a while.
Yeah. Like be conscious of your body and space eventually.
Like sometimes when I tell people to pick up stuff from the ground, I do like that pendulum swing so that you're just like keeping your spine neutral. Yeah. Or like I actually like lunge squat sometimes because I have to be a good chiropractor and show good posture as well. So I try to tell my patients that, and that probably applies to moms and dads. Awesome. Oh, this is a fun question that I think I saw on your website, but why should everyone have a squatty potty?
Oh, yeah. So, I mean, ultimately it just maximizes the muscle's position. So, way back when we used to dig holes and squat to poop. And so what the squatty potty does is raises your knees above your hips. Yes. And that there's a muscle called puborectalis. But when knees are above our hips, then that muscle is kind of relaxed off the edge of the rectum. So where the rectum comes down, the puborectalis muscle comes around it.
Okay.
When the knees are at 90 degrees or less, that muscle is a little bit more taut. And so if that muscle is tighter than it should be, or if someone is already dealing with like slow transit constipation or some other things going on, then that muscle around the rectum could create a barrier to full elimination. So people could have incomplete emptying, they can have urinary complaints. And ultimately the stool just helps put you in a better position so that it's a straight shot down versus like a kinked toes.
Kinked toes, yeah. So it just like relaxes everything, so it allows it. I think I do have one, so you'd be proud, Dr. Maggie. But I think in chiropractic school, we actually talked about that, and everyone was trying to get a squatty potty.
And I even tell moms and, you know, people that are in the thick of it, of motherhood, of like, it doesn't have to be a squatty potty. Like it can be any kind of stool, a kid's stool, whatever.
Yeah.
It's
They're
just
really cheap though. Like something
it's just like something just to lift your knees up.
Yeah. I have a funny story with that because when my family is from Thailand, and actually there they still have, you know, the toilets that are it's not the westernized, like you sit on the toilet. So, but I was like scarred as a kid because I'm like, what is this? I can't go to the bathroom in this, but it's actually like better for your bowels, for your bowel movement. So it was really funny. But as a kid, it was very traumatic for me. But they know how to poop there. So that's
they probably have way less dysfunction than we do.
You know, because
sitting in chairs all day. And
Yeah, so it's like really funny. I was just thinking about that. I was like, oh, so traumatic as a kid. But they knew better. So awesome. So thank you so much, Dr. Maggie, for coming in today. I just have a few final questions. So for people to find you, where can they find you on social media, online? I know you have a long wait list, but still for people to get to know you.
So, I mean, I'm on Instagram, Gaia Women's PT. I'm on Facebook. My website is just GaiaWomen'sPT.com. I do have a new therapist starting this week and another one starting in January.
Oh my gosh, that's amazing.
We'll have much more accessible appointments and availability. Those are the main places to find me.
And then you said you also do some virtual in Maryland as well. So virtual in Maryland. And I can do virtual consults for people outside of Maryland and West Virginia as well. Oh, okay. So that's good to know. Another kind of like fun question for you, final question. What underrated tools are indispensable for your job? Oh. Yeah. I mean, my hands. There we go. There we go. That's for me too. That's a great thing about our job. I feel like we don't need that many tools. We're like, my hands. I don't need a lot of fancy machines or, Yeah, same with me. I just need my needles too. And what occupation, other than what you do now, would you like to try for fun? I have my answer actually. This isn't super fun, but I mean, honestly, if in my next life, I would probably be a nutritionist. Nutritionist? It's fun. I always wanted to be a barista. Oh, that's fun. Yeah. See, that's way more fun. Cause nutritionist is still like it's still like fun though. No, it's still fun though. I still like that. That's something I've always been interested in, but you make me kind of want to do pelvic PT now. I'm kind of like, I kind of want to learn more about this. I actually, a little off topic, but I got this book on like visceral manipulation too, which is really interesting. Yeah. It kind of goes into my organ manipulation in the Chinese medicine realm. But I just wanted to be a barista for fun, but I'm not like long term because I feel like that would be hard on my body. But I jokingly say with my husband, "Why don't I be a barista, babe?" And like, I don't know, you might not have to use your brain as much, so it could be a little. It should be art. Be more creative. Like I could just do latte art all day. But thank you so much again, Dr. Maggie, for joining me and educating the world on pelvic floor health. Because I think we all need it. Me. Yes. So again, thank you guys so much for joining me on this episode of Araya Holistic Healthcast. And I'll see you next time.